Thank you very much. And it's a pleasure to be here with all of you. And I know we are doing this virtually because we are in the middle of this pandemic. But what I'm hoping to do over the next 20 minutes is lay out the state of the pandemic as it is today, in early October, to talk through where we've been, and talk about where both the future of this pandemic goes, but how it should get us to think more creatively about managing future pandemics. So we are in what I would say about month 10 out of an 18-month pandemic. Now, let me explain why I say 18-month pandemic. So if you are using a baseball analogy here in the United States and other places that love baseball, I would say we're in the bottom of the fifth inning of a 9-inning baseball game, where we hope it doesn't go into extra innings. So let's talk about the timeline for this pandemic. I mark the beginning of this pandemic around January 1st, because it was at the end of December that WHO was first informed of the presence of an infection going through Wuhan, China. And so if January 1 is when the clock starts ticking, I believe that at least in the United States, we will have started to really bring the pandemic under control by the end of next June. That's when we're going to see large proportions of people getting vaccinated. Let me be very clear that the pandemic will not be over by next June. We will be dealing with this virus for many, many years in many other parts of the world. And certainly as I go beyond the United States and think about Caribbean nations, Latin America, Europe, Africa, other places, it may be a more delayed timeline. It may be more summer to fall of next year before widespread vaccinations are available. But at least in the United States, I expect that a majority of Americans who want to get vaccinated will have gotten vaccinated around next summer. So that gives us about an 18-month timeline. So in the first half of this pandemic that we've experienced, what has happened? The virus began in Wuhan, China, we believe, spread in December through probably to many other parts of China, and had probably gotten out of China by December and started spreading across much of the world. And what we see now, as we are about 10 months in, is very uneven spread and uneven responses. And I want to talk about both of those as I look to the past. So uneven spread. Don't see this virus affecting all parts of the world equally, right? We see some parts that have been hit very, very hard, partly initially because of travel from China, but some parts of the world that have had a more delayed response. Western Europe was hit very hard early. Eastern Europe is starting to see big increases now. Latin America was not initially hit as hard, but of course, we have seen, whether it's Peru or Chile, or of course, Brazil, which is one of the major hotspots in the world, Mexico, but other places. Some of it started a little bit later, but many of these countries have been struggling with ongoing pandemic risk. Certainly, India initially did a very aggressive lockdown and looked like they were doing well, but these days are generating 80 to 100,000 new cases a day, and again, is one of the global hotspots. And the United States has just been a poor performer, certainly compared to other high-income countries throughout this entire pandemic, really one of the laggards, when, of course, America, I believe, should be a leader in this. So why all this variation? Why do we see so many differences across the world? What I would say is it isn't because some populations are more immune than others. I mean, there's been that theory. I've seen no evidence for it. I've seen no strong evidence that any group of humans are more or less susceptible to this virus than any other group of humans. So I believe we're all likely equally susceptible. So the basic reason why there are so many differences, why some countries seem to be doing so well and some countries are doing poorly, is, I believe, largely about policy response, public health response, and the effectiveness of that response. So people often say, well, what are examples of countries that have done well? There's quite a few. Certainly a whole set of East Asian countries have done very, very well. And not just the wealthy ones like Taiwan and South Korea and Japan, but also more middle or lower income countries. Middle income countries like Vietnam have done a very, very good job. Of course, it's not just East Asian countries. We've seen several European countries, including Germany, generally having done well. There are countries in the African continent that have done well. So we can point to many countries that have done a good job managing this virus. So what does doing a good job mean? Well, if we take a step back and ask the question, how do we control this virus? What do we know about the way the virus spreads? And what are tools we have for countering the virus? The major tools we have. So we know that the virus spreads from person to person when people are interacting with each other in close range. And the virus spreads much more efficiently when people are indoors and much less efficiently when people are outdoors, largely probably just because of airflow and ventilation and concentration of the virus. If you're outside, good ventilation necessarily means you're going to spread it less. If you're indoors, it will tend to accumulate. If that's right, and that is right, that's what the science tells us, then what we know in control measures is wearing masks is very, very helpful because it reduces how much virus you spread if you are potentially infected. We also know that keeping social distance is very, very important. The further away you are from other people when you're talking or singing or just being around them or breathing, the less virus you will transmit to them because distance matters. We've already talked about indoor versus outdoor. And then the other tool that we have, which is a long-standing public health tool, is around testing and tracing. If you can have people who've been infected through testing and you can isolate them, then they won't infect other people. And if you trace their contacts and quarantine them and test them and prevent them from infecting other people, that's how you break chains of transmission. So let's look around the world at what countries have done and how people have gotten to where they've. So Japan has had a very aggressive strategy on mask wearing. There's close to universal mask wearing in Japan. South Korea's primary strategy has been on testing and tracing. New Zealand, which has done a very good job, has been largely around lockdowns and pretty substantial social distancing, with okay levels of also testing and tracing in the other ones. But that's been their primary strategy, has been social distancing and lockdowns. And a country like Germany has done a mix of all of them. None of them at the same level as some of these other countries, but a combination of all three has kept the virus under control. So the big picture point and the first lesson to be learned here is when we look in this pandemic across countries, it is not like there is some magic formula. It's basic public health. And it is also not like there's only one strategy for controlling the virus. There are multiple strategies. And go all in on one or do a combination. And different countries have taken different approaches because, of course, different countries have different cultural values and different strengths and different capabilities. Now I want to turn a little bit of my attention to the United States and talk about the response here, because this has been the response that I think has most baffled people around the world. America is a very wealthy country. America has incredible capability in the biomedical sciences. And I think most people expected, I certainly expected, that the response in the United States would be much, much better than it has been. America's response has been, to be quite blunt, has been awful. It's been abysmal. So why is that? It has been that because we have largely failed to implement those public health practices in a consistent way across the country. There are some states that have done a good job, but many, many states have not. And part of that, and this is the second lesson of this pandemic, which I'm going to spend a few minutes talking about, but the part of the reason that has happened is because of misinformation. One of the biggest challenges in this pandemic has been the sheer amount of misinformation, some of it coming from the fact that there has been a vacuum of communication, and I'll explain all of this more in a second, but some of it quite concerted. So misinformation happens when people get conflicting information. They get information that confuses them about what the right answer is. And the reason why that's so harmful is it undermines people's willingness, resolve to engage in public health measures. A country can put in whatever public health measures it wants, but if people don't adhere to them, if people don't engage with them, it won't work. Have a policy on mask wearing, but if people don't wear masks, it's not going to protect you. And what has happened is because of a lack of clear and consistent communication from the federal government in the United States, you have seen a lot of other people step in. And while some of us have tried to offer specific science-based guidance, you've also seen a lot of people come into this fray who don't have any scientific basis, who don't know much about this, who have started trying to share information with people that's just misleading or wrong. And it's a reminder to me and to all of us in the public health community that in the middle of a pandemic, we all have to speak up and we all have to advocate for science and for science-based approaches. We can't just leave it up to the federal government or state governments because they will often get. But I want to talk a bit about a second part of misinformation, which I think has been very powerful, which is that it's not just people stepping in who don't know what they're talking about. There's actually been quite a concerted effort by certain political groups to try to spread misinformation in a very coordinated way to try to undermine public health. And this is a very big challenge. And I think we in the public health community have to go back and really think, especially for future pandemics, which I will talk about in a minute. We'll have to think about how do we counter this? What can we do to make sure that in the future we are not caught blindsided by the fact that there are so many people spreading misinformation? So that's sort of point number two, is that misinformation has been a major headwind that has made responding to this pandemic much, much harder. Okay, I want to move towards thinking about how does this pandemic fit into a broader framework of disease outbreaks, and what does that tell us about what the future likely holds? And then wrap up by talking about what we need to do and what we need to do differently in the future. So if you go back, I mean, people often have been saying to me, well, this pandemic is a once in a century event. And it is true that you probably do have to go back to the 1918 flu pandemic to think about something that has been as disruptive as this one. But I think that misses a bigger point, which is that we are starting to see more and more outbreaks around the world. The sheer number of outbreaks that are happening is growing and has been growing for about 30, 40 years. So we should try to understand what is causing this increase and what implications it has for future pandemics. Because I believe, and I will explain why I believe this in a second, but I believe that we are entering an age of pandemics, that we are going to have more of that. We need to get ready for future pandemics. If we are smart, maybe they will not be as disruptive as this, but this will certainly not be the last pandemic of our lifetimes. So we have a long way to go in terms of thinking about how do we prevent future pandemics. So why do I think we're entering an age of pandemics, and why have outbreaks been going up? Well, one thing to understand, and this is another key lesson that I want people to walk away with, is majority of novel infections in humans, most of them actually, come from animals. They're zoonotic in origin, and they really come when you have a species jump, a virus that might be circulating among bats, as this one was, or among other animals, for a variety of reasons, makes a jump to human species. And the humans don't have any natural immunity to it, and it quickly spreads and can devastate populations. Essentially what has happened here. So why is that happening now more than it was 50 years ago? There are a couple of reasons. The single biggest one is economic development and environmental change. I guess those are two related ones. Economic development means that people are eating meat more. People are coming into contact with animals more. And so that's one feature. And that has happened certainly in China. It is starting to happen in India. It is happening across Latin America. It's happening in other parts. And we're going to see it happening across the African continent over the next 10, 20 years. Economic development is a really good thing. It lifts people out of poverty. It improves their health. So we should celebrate economic development. But we should understand that one of the costs of it is these interactions more with animals. That leads to the second related issue, which is environmental change. What is happening in many places is deforestation, people going into traditionally animal habitats. Of course, all of this is overlain by climate change, which is also, I think, accelerating many of these phenomena. And so you put it all together, and what you end up with is a lot more disease outbreaks happening in humans than we've ever seen before, and happening at a faster and faster. And I don't believe or expect that any of that is going to somehow magically go away in the years ahead of us. So we will see more disease outbreaks. But here's the part where you go from disease outbreak to pandemic. And that is another phenomenon that is happening, which is globalization. Globalization means the amount of international travel has gone up dramatically. Of course, not this year because of the pandemic. But if you look at 2019 versus 2009 versus 1999, massive growth in international travel, a lot of it driven by China. So one of the reasons why the 2003 SARS outbreak did not become a major pandemic, but this SARS outbreak, this SARS-CoV-2, COVID-19 disease outbreak became a global pandemic, is because China is so much more mobile now than it was in 2003. Chinese people are wealthier, they do a lot more traveling, both personal travel and business travel within China, and they do a lot more global travel. And that means a virus outbreak in Wuhan very quickly lands in Beijing and Shanghai. It also very quickly lands in Rome and New York and Mexico City and Sao Paulo, right? It becomes a global pandemic much, much more quickly. That phenomena of globalization is also not going away. We will see more and more of that in the years ahead. Especially as India continues to develop economically, African continent begins to develop more economically. You're going to see again more international travel, and again as Latin America there continues to grow and economically develop, you're going to see more international travel. So globalization is going to turn local out into global outbreaks much, much faster, and that means that we really are entering an age where we're going to have a lot of pandemics. So I want to talk a little bit about what are the things that we need to do as we move forward and as we think about the future. What are the things we need to do to really make sure that we are better prepared? So first is we need to make investments in public health. And these are going to have to be very large investments. Public health has been getting cut in the United States, across Europe, in many places. As new medical technologies have come online, we've been spending more and more money making sure people have access to healthcare services. And again, as a physician, I believe in that. We should be investing in that. But that has meant that basic public health, like surveillance, like having a public health workforce who can do contact tracing, laboratories, and all of the features of public health that are so critical have not gotten the investments they need. That needs to change. That needs to change quite substantially. Second, and related, is that part of the failure of the public health infrastructure in this pandemic has been the terrible underlying data infrastructure that often leaves us blind. In the United States, this virus, for instance, has disproportionately affected Black Americans, Latino Americans. We didn't know that. We didn't see that coming because our data infrastructure underlying all of this has been so bad that we were blind to that phenomena until very late in this pandemic. We've got to have very, very different data infrastructure for public health going forward. And that actually raises all sorts of interesting possibilities. When I think about my own analysis in this pandemic, what are the data sources I turn to? Some of it comes from the government, but a lot of it comes from the private sector. It comes from Google. It comes from Open Table, which tells you something about reservations and dining and what people are doing. So there's a lot of private sector data that actually really helps shape what we understand about what's happening with the disease outbreak and pandemic. So when I think about future investments, it's not investments in public health data, which are critical. It's not just investments in public health infrastructure like people and public health workforce and laboratories. It's also about partnerships with the private sector. It's about partnerships with technology companies. It's about partnerships with other organizations that are going to bring a lot of data and information to bear on this. All right, let me make a couple of last points and then I will finish. One of the most remarkable things in this pandemic has been how quickly we have developed therapies and vaccines. We should not take this for granted. Part of the reason we've been able to develop vaccines, again, we don't have one that's identified yet as safe and effective, but I do believe we will in the next 6 months, is that we had so much progress on this virus because we had done all this work on the previous SARS virus. And these are very related cousins. That allowed us to jumpstart our vaccine process and our therapeutic process. We should not expect that we're going to get that lucky in the future. We need to make massive scientific investments in platforms for developing vaccines for viruses, for developing countermeasures, therapeutics, developing diagnostic tests more quickly and efficiently. All of that is going to be critical. It's going to take, in the United States, but I would say globally, tens of billions of dollars a year in investments, if not more, because the cost of not having these things runs into the trillions of dollars. So that, I think, is going to be another major focus of future investments around pandemics. So let me just finish up by saying this has been, of course, an extraordinarily difficult time for all of us around the world. No country has been spared. Some countries have suffered more than others, in large part due to inadequate policy response. Countries that often don't have a lot of resources have been able to do a very good job, and many countries with good resources have not been able to do a good job or have done a poor job. So resources of the country are not the biggest predictor of whether you can do a good job or not. That said, we still have some ways to go in this pandemic, and we should not, for even countries that are doing well, not get complacent. We will still have challenges. But I am hopeful. I'm hopeful that we will have identified vaccines over the next couple of months, that we will have, let's say, a few of them over, let's say, 3 to 6 months. There are going to be global ramping up of production. There's a very good program through WHO called COVAX, which I'm enormously supportive of. I think it's going to be extremely important. And I didn't talk enough about the role that WHO has played. In general, I think WHO has played a very strong role in this. And programs like COVAX, if they are successful, will allow for distribution of vaccines to much of the world. This is not a time for vaccine nationalism where we try to hoard it for our own selves. If we work collaboratively, I do believe that we can get large chunks of the world, certainly the most essential people, vaccinated in 2021 and much of the world vaccinated in 2022. But it will take a global concerted effort. Last point. Pandemics remind us of our shared humanity. If we act alone, if we act based on our own individual self-interest, we all end up worse off. But if we work collectively, pull in the same direction, we can defeat this virus, we can bring the virus under control and get our lives back. So thank you very much for listening.